I'm S.R. Evans, and I'm from Greenwood, Mississippi, and I went to medical school at Vanderbilt University in Nashville, Tennessee, where I met my wife, the former Amy Hemstreet. She was also at Vanderbilt in midwifery school, and she's from Morganton, and that's how I ended up back here after we finished our training at the University of Virginia, and I completed my OBGYN residency there. We decided to move home to be close to her family. So I've been here 5 years, and we have 2 children, are expecting a 3rd child soon at the Family Center at Grace. We're very excited about that. At Women's Health Group, we do all of our deliveries at Grace Hospital, and we're members of the Department of OBGYN there. We're fortunate to have a special care nursery where we can handle all pregnancies that occur after 32 weeks. We have an excellent nursing staff at Grace Hospital, one of the finest I've worked with. I've had the fortune of working at 2 very large hospitals, one at Vanderbilt University and one at University of Virginia, and I can honestly say that this nursing staff we have here at Grace Hospital is as good as any I've worked with. Being in a community hospital, we have the advantage of really functioning as a family. We all know each other and work well together, and so we take care of patients just like they're part of our extended family. Well, since I've been here over the last 5 years, there's been a lot of progress in terms of the facilities. We have a new family center with new birthing rooms. They're very large and spacious. They're very new and attractive and modern, and patients really enjoy having babies there. I've got lots of patients who delivered in the older rooms, and they can really tell a difference. They feel like they're in a very nice modern facility. Along with that, we have a very young, energetic nursing staff, and so they really do their best to meet patients' needs and provide excellent care. We're fortunate to have neonatology services 24 hours a day, so that anytime we think that a baby might need a little bit of extra care, we can call on them and they're at our side, and they can give a baby the extra attention it needs, whether it's in the room with the mother or in the special care nursery. So we have 2 full-time neonatologists, and they're both excellent, experienced physicians, Dr. Pascal and Dr. Foy, and they've both practiced in very large, busy neonatology units and other large centers. The advantage of having our neonatology services is that if we have a delivery that occurs after 32 weeks, we're able to keep that baby and the mother in the hospital and provide all the care that they need without sending them out of our community and putting them through the difficulty of traveling long distances to visit and provide the services they need. We're fortunate at Women's Health Group to have a variety in our experience level. Dr. Pope has been here the longest, and he's the senior partner of the group. Dr. Pope is in a position to be a mentor, for the group. My wife is having a baby soon, and that's who she chose to go see for her pregnancy, and she's been very happy just because of the experience level he brings to the practice. Dr. Kirk is very experienced as well, but he really makes a great effort to stay at the forefront of medicine, so he's always finding out about new technologies and the way to integrate those into his practice. Dr. Salzman and Dr. Samolki have joined Grace Hospital in the last 2 years and come to us from Marion, and they're both just excellent physicians to work with. They're outstanding OBGYN physicians who are both very experienced. They're very well trained from one of the largest OBGYN training programs in the country at Parkland Hospital in Texas. Having a wife who's about to have a baby soon, I can honestly say that I would be happy with any of the physicians in our group providing her care. We're also very fortunate in our group to have Rhonda McNeely as a midwife who provides care at Grace Hospital. Rhonda has been here a long time and is very well known in the community and very well liked. At Women's Health Group, we offer comprehensive gynecology care. I'd like to talk a little bit about some of the services we offer in the office. We have a full range of ultrasound services, including 4D ultrasound, and so our pregnant patients are actually able to see the face of their baby, usually between 28 and 32 weeks. And it's really amazing to watch their faces as they see the face of their baby for the very first time. Hysteroscopy is a procedure that traditionally has been done in the hospital setting, but in the last few years, more and more it is being moved to the office setting. Hysteroscopy is a procedure where we look inside the uterus and we can evaluate for problems such as abnormal bleeding and pain. We're also able to perform several treatment procedures with hysteroscopy, such as Essure and endometrial ablation. Essure is an alternative to tubal ligation that allows permanent sterilization and can be done in the office without any cutting whatsoever. The procedure is usually done with just a local anesthetic, and the patient goes home after the procedure and is back to normal within a few hours. Endometrial ablation is a procedure that can be done for abnormal bleeding and is an alternative to hysterectomy that allows a patient to return to work within a day or two and has excellent outcomes. We perform all of our inpatient surgical procedures at Grace Hospital. We've been very impressed with the staff at Grace Hospital and our ability to perform procedures that are at the forefront of medical care. For example, we've been performing total laparoscopic hysterectomy for about 4 years, and we've had excellent outcomes from that procedure. Traditionally, hysterectomy required staying in the hospital for 2 to 3 days and being out of work for 6 to 8 weeks. Now with a total laparoscopic hysterectomy, most of our patients can go home the same day or the very next day and are back to work within 2 to 3 weeks with significantly less pain. Total laparoscopic hysterectomy allows us to do the procedure through very small incisions that are less than a centimeter in size. After 6 weeks of healing, it is very difficult to see the scars at all, so the cosmetic outcome is very appealing. Urinary incontinence is another procedure that we can usually cure with a simple outpatient procedure. It requires only a small incision less than a centimeter in length, and with a 30-minute procedure, which requires putting a small sling under the bladder, we can usually cure up to 95% of urinary incontinence. At Grace Hospital, we're very fortunate to work with an excellent surgical team. They bring a combination of talent, experience, and energy to the table and are a pleasure to work with.